Good morning, everyone. This is the Incarceration Prevention and Reduction Task Force Joint Behavioral Health and Legal Justice Systems Committees meeting together. We meet about 4 times per year, and just wanted to go ahead and before we begin to acknowledge that we're gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. And so I'm going to go ahead and call this meeting to order. There is no packet for this meeting. We're having some presentations today, largely from the County Executive's Office. And I'm here to welcome Kayla Schott-Bressler, who is here to discuss a couple of items. And go ahead, Kayla, when you're ready.
Thanks so much, Councilmember Hamill. Hi, everyone. It's good to see you today. I know many of you. I'm Kayla Schott-Bressler. I work in the County Executive's Office on strategic initiatives. And I know I was invited today to update you on the Crisis Relief Center project, as well as continue discussions on the state legislative agenda. I'm going to sprinkle in some other exciting updates into the discussion, and then want to leave a lot of time just for open dialogue and questions at the end. I will also say, please feel free to raise your virtual hand or just shout out as I go along. I'm happy to answer questions and have some discussion as we go as well. So I'm going to share a PowerPoint. Apologize for the sort of rudimentary design elements, but I think you will all understand. Okay, can you all see my screen okay? Okay. So, you know, the 23-hour Crisis Relief Center, I think, is many people's sort of first priority in the list of Justice Project initiatives, and we certainly have taken it on as one of the first things we're doing. Oh, Bruce, did Bruce have a question?
Is everybody else able to see the PowerPoint? Because for some reason I can't.
No, okay, sorry, I thought I got head nods, yes.
Oh, okay, great.
We don't see it, Kayla.
You don't see anything?
No.
Right, thank you.
Weird. Okay, hold on. What about now?
There we go.
Okay, and if I go right now, does it look normal?
Yep, you're good.
Okay.
Yeah, you're good.
Okay.
Yep.
Thanks, everyone.
Yep.
Okay, so 23-hour Crisis Relief Center, initial priority in the Whatcom County Justice Project. It's going to provide outpatient behavioral health, urgent care, and crisis services, and that's going to be done. It's going to be open all the time, 24/7. The 23 hours indicates how long the typical individual patient may stay in order to ensure that the licensure remains an outpatient facility, and provides a little more flexibility on the service side. The WACs for this facility, the Washington State Administrative Code, are still being developed. This is a new type of service in our state, and our health department staff are watching that process very closely. So aside from King County, we're going to be one of the first communities in Washington State to have one of these facilities. One of the emphasis that the facility will have is to allow walk-in as well as law enforcement drop-off for services. And I think we are attempting to design this in a way that it can absorb any law enforcement drop off from like a capacity, like a person capacity volume standpoint. Obviously there's going to be safety considerations and those sorts of things, but part of the state law authorizing the licensure for this type of facility is really geared at allowing a law enforcement drop off, and also providing some basic medical services on site, so you don't get into as big of an issue around medical clearance that we might have at some existing behavioral health facilities. So the model we're looking at is that the county will build and own this facility, and then we will lease it to a licensed behavioral health provider who will be the tenant and service provider at the facility. I see Perry Mowry is also on the call. So Perry, as I'm going along, if I get anything wrong, please chime in. Okay, so progress to date, we anticipate it's about a $15.5 million project. As many of you know, the county has secured $9 million from the state legislature. The county council has also committed $4.2 million in county funds. That's primarily ARPA, and we anticipate probably also spending some behavioral health sales tax funding there. And we think that, and I believe, sorry, not we think, I believe that the land purchase was covered either from general fund or the county's other county local funding. And we're working to still secure $2.3 million from the state legislature or from grant funds. So as we get into the state legislative discussion, you will hear a little bit more about that. We formed sort of an internal task force to work on this project. It's the executive's office, staff from the health department, facilities department, our finance department, and legal department. We're meeting once or twice a month, and we've staffed up both in the health and facilities department in order to execute this project. And we're working on finalizing a contract with an experienced Medicaid and crisis services consultant, and they're going to help us write the scope of work for the operational RFP and also model what the Medicaid billing is going to look like on this facility so we can get a better sense of the operational costs. Does anyone have questions so far? The model or anything?
Committee, Stephen.
Yeah.
Thanks, Kayla. I see we are structuring this the same way we did with the Ann Deacon Center as the landlord.
Yeah.
I think the pre-planning for that was not as thoughtful as it turns out it needed to be, and we've been left without access to data or much influence over improving the service delivery, and I hope we correct the terms of that kind of tenant agreement or MOU, whatever it turns out to take the form of this time around.
Yeah, absolutely. And we anticipate the RFP will release in 2024 for the service provision will include sort of roles and responsibilities for the county as well as the service provider, and what our very detailed expectations in terms of contracting and the county's role in quality assurance and improvement over time. But
Okay.
hear that concern. I also think if the county ends up providing operational funding, that gives us another leverage point going forward over the quality and model for service delivery. So,
Committee, any other questions at this point? Okay, seeing none, go ahead, Kayla.
okay, thanks. And
Dan, this is Brian Estes.
Oh, hey, Brian, go ahead.
Yeah, I'm in my car, so I can't see the slides. What's the capacity, like bed capacity for this?
we're not sure. Perry's, we're not constrained by any sort of Medicaid rules. It's a recliner based model, so we can sort of scale up and scale down as needed. So we're looking to work with our consultant to look at data from law enforcement and data from Peace Health to try to scope the size. But we anticipate, currently the Ann Deacon Center, it's 16 beds on each side, which is related to a Medicaid restriction. And we will likely vastly exceed that 16 number with this facility. Our hope is that it meets the demand for this type of service. And so we're looking at that pretty closely. I don't know, Perry, if you have anything else you want to say there.
Yeah, no, I would tend to agree that we've done some initial information gathering just in regards to BPD and obviously the crisis stabilization center, as well as some EMS information just about attempting to estimate what utilization would need to be. And the primary, at least from my perspective, one of the primary considerations when we talk about what are the number of recliner chairs, that is going to be, you know, sort of directly connected to the size of the staff and very specific staffing requirements and model as well. So great question. And I think, you know, more to be determined as we gather information and take a look at other models and what the needs are of the county. Thanks, Kayla.
So we've got a number of hands up, and I'm going to call these in order as I saw them go up. I'm going to call on Arlene, Tank, Peter, and Heather. So Arlene, go ahead.
Yes, I'm asking this question because I missed the last couple of meetings. Where is the location that it will be constructed?
Yeah, you know, I think we're trying not to get ahead too far too far ahead of the neighborhood outreach process. So, but I do anticipate that the framework for the justice plan sort of contemplated that this facility would be located at the Division Street campus.
What? The what campus?
Division Street.
Division Street. Oh, yes. I'm very familiar with that. I worked there some time ago. By the way, this is my dream come true. I am so happy that this is a prospective project. We're here to provide oversight because we want this to be an effective base cause of mental health problems that turn into incarceration problems. And I just can't tell you how happy I am.
Thanks,
Thanks,
Arlene.
Arlene.
Thank you. Go ahead, Chief Tank.
Sure. So my question is, it said law enforcement drop off versus first responder drop off.
Mm.
Is there a specific reason why we're not saying first responder versus law enforcement?
Yeah, I might just have the language wrong. Perry, do you have a sense of whether the WACs are more focused on law enforcement or if it's supposed to be broader than that?
I can share with you, I've got just a blurb that comes out of Senate Bill 5120 and then the specific, you know, RCWs, you know, et cetera. So the section of the Senate Bill 5120 that was a final portion of that document says 23-hour crisis relief centers means a community-based facility or portion of facility serving adults, which is licensed or certified by the Department of Health and open 24 hours a day, 7 days a week, offering access to mental health and substance use care for no more than 23 hours, 59 minutes at a time per patient, and which accepts all behavioral health crisis walk-ins, drop-offs from first responders and individuals referred through the 988 system, regardless of the behavioral health acuity, and meets the requirements under Section 2 of this Act, which goes on to some other components.
Yeah, so I would recommend maybe to change that in that slide to say first responder, because with just law enforcement, the assumption would be that other first responders that are not law enforcement will not be able to drop people off.
Yeah, that's great feedback. Thanks for catching that.
This is Brian Estes. I just wanted to add that I think the issue here is that law enforcement can just drop them off and they don't have to wait. Unlike taking them like to an ER or other facilities. Is that the intent? I mean, that's how this would work, right?
The intent is to have the first responder drop off be as seamless and efficient as possible. And so I don't know sort of what that looks like yet from a number of minutes standpoint, but would strive to make that as efficient as possible. Perry, I don't know if you have anything else you want to say there.
I would tend to agree. I think that I was just kind of researching just a little bit more if it made specific reference to breaking out, you know, first responders to, you know, law enforcement, et cetera. But that is certainly the intent in the reading that I have. I can provide a final bill report of the 5120 to folks, and they can, you know, take a look at that for their own research and interpretation as well. But that is my understanding. I guess this is what I'll say, Kayla.
Thanks.
Peter.
Mary, if I may, a number of state legislators went to Arizona and they're trying to model like the 9 and 8 system around that. And one of the components of Arizona's system is this sort of seamless, very timely drop off where you don't have law enforcement or first responders waiting, you know, a half an hour, an hour in intake. And that's part of why the state, you know, is pushing these facilities. So I'll just leave it there.
Thanks.
Okay, everyone, I appreciate the conversation, but we do need to keep these questions in order. And I've got a number of hands raised, including Peter, Heather, and Courtney. So Peter, go ahead. Peter Fraser, go ahead, please.
Kayla and Perry. So where does this model, where does this model come from? I'm aware it's new to Washington State, and we in King County are kicking it off. But when you're designing the service and the facility, what models are you looking at in what communities?
Yeah, so the Arizona model that Brian mentioned is the one that the legislators looked at most closely. There's also facilities that we've had some discussions about in Bozeman. There's some facilities down in the Portland metro area. And then I know Eugene, Oregon is also has issued an RFP for a service provider. So we're looking at all of those models as we build out here. The King County facilities, at least the one that's going in first in Kirkland, is quite a bit larger than what we're anticipating here, and includes sort of within the same structure, crisis stabilization, and I think an ENT as well. So a standalone facility sort of co-located with crisis stabilization is a little bit different model, but we're certainly have some communities who are quite a bit far ahead of us, and then some communities who are a little bit ahead of us sort of in their procurement for a service provider. And so they've probably taken some lessons learned from the places that have already been operational for a little bit longer. So I think we have a lot of communities to look to that are in different stages.
Right. I presume that having this close to the Ann Deacon Center would be important. There would be, proximity is part of the model between crisis stabilization and 23-hour.
It will be helpful.
Okay.
Would be helpful, yeah.
Thank you.
Heather Flaherty, go ahead.
Thank you. I think Perry answered part of my question, that this is for adults 18 and over. And we don't have anything like this in our community for kids at this stage. And I would love to request for this committee, if there's interest, thinking on the incarceration prevention side, 75% or more of the people who end up in our jail started out with mental health and substance use issues as youth, as kids. And so is there an opportunity for us to explore additional support, because this is awesome and sorely needed? I am curious about, Kayla, you said that you expect this to meet the demand. I'm curious if there are studies that you have or any kind of demand assessments that you're making that statement. My thought is that it will be overflowing, but maybe I'm just steeped in really sad data all the time. So,
I think, Heather, I think there's it's a voluntary facility. So the demand for, I'll let Perry speak to this a little bit more. I don't think meeting the demand means that there's not going to be people in crisis.
There's a Blaine clinic that is behind a crisis center for young people, but I don't know exactly what age it starts, but it definitely covers young people, adolescents.
And Heather, I was just saying, I think it sort of just depends on how we define demand. I think we're trying to scope it so there's not people sort of like, we don't anticipate a lineup or, would like to not be in a position where we're turning people away who would like to come to the facility. And I think it's just what does demand mean for a facility like this, particularly a voluntary facility? Perry, do Do you have a
You know,
different perspective on that?
only one, in the sense that I was really intrigued with the discussions that we had. I think, talking with other providers and designers, just in regard to the fact that because it is a recliner model as opposed to individual rooms such as the Ann Deacon Center for Hope, that the ability to actually expand and or contract the capacity, if you will, needs to be kept in mind in terms of the design of the building itself, because then honestly expanding would obviously include staffing to be able to expand that. But it's something that could actually on a physical basis expand and contract with the need that was within the community, maybe the season, hard to honestly say what all the driving factors were, but I was intrigued with that thought process and idea. Because it's really not available for, other types of facilities that are similar to this. Yeah.
Okay, I'm gonna call on Courtney, and then I've got a comment and a question. Go ahead, Courtney.
I was just gonna say, I know there's a lot that is still early stages. I just wanted to offer this to keep in your back pockets to think about as we're ramping up this project. But from the public defender's side and perspective of things, I'm hoping, oh, please ignore my desk phone, which is ringing right now. I'm hoping that there will be some kind of conversation between law enforcement, the health department, and whichever agency contracts with the new facility and with triage about how to actually divert people in the field. We're seeing a lot of people that are coming to the jail and getting charges for things that even upon reviewing the probable cause documents, it is very clear that this person was voluntary, willing, and requesting triage, and law enforcement do not feel comfortable or might not even be aware that triage is an option. And we're seeing it every day where we're not really having diversion happening. What's happening is people are coming into the jail and our office is diverting them. But at that point, you've already got a new cause number, your life's been upended. So I'm really hoping that with triage as it exists now and the new facility, that we can figure out how to handle those workflows better, because we should not be diverting people after it's a little too late to divert them. And we know that there are examples where someone might say, hey, I want to go to triage. And because of how they're presenting at the time, law enforcement may not think that they will be screened in, but they are not making those calls to service. And that is also affecting the data that we're seeing. You have to make that call to service. You can't not try triage, and you can't not try with DCRs when things are lapsing into an involuntary realm. You can't not try these things just because you're so used to people saying no. You have to try those referral channels. Otherwise, our data is meaningless, and law enforcement is the gatekeeper in this process.
Thanks, Courtney. Good points as always. I do want to, so one statement and then one question real quick. I'm just going to take a point of privilege here as the chair. Chair always goes last. We call on the committee first to make sure that everyone's voice is heard. But I'm going to take my time right now real quick. There is a juvenile facility in Sumas that I believe is a 23-hour facility. It just opened. Went to the groundbreaking with some people on this call. It's pretty far out there, so it doesn't meet the needs necessarily of everyone. And then I just want to point a fact. And then I just wanted my question that Perry, you had mentioned in your remarks that this facility would take patients regardless of acuity. And I just want to get, I want some clarification on that, please.
So yes, that is actually what even the Senate bill and then the ensuing RCWs and WACs that are coming out of that actually speak to, that regardless, that in essence, and I think that the legislators, my perspective, certainly had some insight into historic barriers, at crisis stabilization centers, and that sort of thing, and then really spoke to that in Senate Bill 5120. So in terms of acuity, the idea historically, one of the things that's happened with crisis stabilization centers is the necessity for medical clearance at the local hospital ER. And it's time consuming. Obviously, it's a time that the individual may disengage from that whole process. The ER may be, of course, very busy, and the individual be there for an extended period of time. If there's first responders involved, we even expand on that challenge of that. So one of the things that the Senate bill, I sent it to Jill, and she can forward it out to folks, makes reference to is ensuring that there's a staff that has the ability to address primary medical need, as well as whatever level of acuity they might have with an individual coming to the facility, whether that be a mental health oriented acuity or substance use disorder oriented acuity, that the staffing is at a level that it is able to address those needs. That's the way that it defines it, within the body. So hopefully I answered that well enough for you, Mr. Himmel.
Thanks, Perry. Appreciate it. Further questions for Kayla on this part of the topic? Go ahead, Raylene.
Thank you. I guess I do have concerns about not enough locations for juvenile, and I also have a concern when the thought about law enforcement diverting. I know a lot of times law enforcement can't necessarily divert because there are legislative mandates for arrests on certain charges in which they can't. But when they can, sometimes they want to have somebody go into a center that's involuntary, and both of these are voluntary facilities. So I guess there's some concern is that it doesn't sound like there can be hands-on on either one of them because they're voluntary. And I mean, I know law enforcement want other options to be able to bring somebody to places, and but right now they feel like their hands are tied and they have to go to the hospital. So I mean, I'm hoping that this will be another option that the public will know that's there, so that law enforcement don't get the phone calls. But I think that's also a need, especially for youth, because I don't think there's a place for them right now.
Thanks, Raylene. And Perry, I just want to provide you an opportunity to clarify a little bit sort of what the capabilities are about hands-on and some temporary detention.
Yeah, I think that it's an interesting dynamic. And again, the document that I sent to Jill, that I'm sure she'll forward out, makes reference to this, and it caused me to ponder. I'll offer that much, that actually it states within the legislative language that if an individual is at the facility and is identified by the staff as possibly being an imminent risk to themselves or others, that they can detain the individual. That requires a different level of staffing. And certainly, obviously protocols and procedures, et cetera. One of the concepts and ideas that they can detain the individual to the point in time that a DCR can be contacted and brought to the facility. Sorry, I should have finished that. And so one of the discussions that we've had, if I had a magic wand, I would say, well, let's office designated crisis responders at the 23-hour crisis relief center. They may be called out, on calls, and that sort of thing. But if we have a DCR there, then that necessity of detaining and what would that actually mean, and et cetera, would change, I think, to a certain extent. So anyway, I couldn't help but throw my own, thoughts in there in that regard.
Thanks, Perry.
Thank you, Perry. Further questions for Kayla or Perry on this one? Not seeing any here. Kayla, you want to just keep going?
Sure. So just want to give everyone a sense of the next steps. Our plan is to do the first step will to be to RFP for the service provider. We want to have the service provider on board before we do our architectural work, so they can inform the design of the facility, and also through before we go through the permitting process, we want to have our whole team together before we initiate permitting. So service provider RFP likely Q2 2024. Then after they're on board, we'll go out for our architectural RFP, likely end of 2024, work through design, permitting, and site prep, and we'll competitively procure the construction firm that's going to build this thing with our facilities department managing the build. Any questions on that?
I don't see any. I have a question if no one else has. I don't see any hands up. So what's the process for outward facing communications with the community when it comes to, like, this is a pretty big deal. Having this level of service provision, how does it work? Is there a plan for that? And what's the timeline for that? If there is a plan, what's the timeline?
Yeah, I think our first sort of outreach and engagement activity will be getting stakeholder input on the scope of work for the service provider RFP. And that'll likely come to groups like this, our behavioral health service providers, the hospital, first responders. And so it'll be much more about sort of informing the scope of service. And then after we have a solid plan for that, I anticipate that we will have like more of a public communication strategy, but I don't know sort of the timing on that or what it looks like yet. But really open to feedback, Dan. Okay, well, I think if you're asking for that, I'll tell you what I think, and I'll call on Peter in just a minute here, but I want to just follow up real quick. I want to understand the integration between this facility and obviously Deacon Center for Hope, but also the waste station, service providers like Lake Whatcom and Unity Care, and we are in preliminary talks with a local tribe for mobile medical units that can provide opiate use disorder treatment. I want to understand how this stuff works together, and I'd love to see that can be an internal plan that we could, try to suss out a little bit, and then get that out to the community as to how we're doing that. And I'll provide you a moment to respond to that. Then I'll call on Peter. Thanks.
So I'm just going to double down on what Dan said. Pretty critical that after passing the levy in November, that we make sure that citizens and taxpayers of Whatcom County understand that the county is moving forward immediately with this. This was, as you know, I'm sure, Kayla, a great, it was a great worry for voters that we're just going to be waiting on all this important behavioral health facility and infrastructure and service. So I like Dan's idea. I think making those public communications as early as possible and would be really good.
Yeah, that's really good feedback. And I think we'd be happy to work with the task force and others on that. I think, a balance between making sure we have a really firm sense of being what the services are going to look like and being able to answer community questions, with also sort of building community confidence and some hope that these services are coming online soon.
It's part of the implementation plan, and that's very much what people were voting on. So that's just the point. Thank you so
much. Okay, Kayla, go ahead.
Okay, that's it for the Crisis Relief Center before I'm going to talk about other things. Any final questions?
I just want to check in with the committee here. Any further questions on this topic before we move to the next agenda item? I don't see anything. So let's go ahead and keep moving then.
Okay, so not
Kayla-
quite the next agenda item, not quite the legislative agenda yet, but just wanted to provide some other sort of non-jail justice project updates to the group.
Go for
I
it.
know, is that cool, Dan?
Yeah, go ahead. Yeah, of course.
Okay.
Yeah.
I know the data project is a really big priority for many on this call and is really important to the community as well as our internal county departments. So I just wanted, I think probably a lot of you have heard this already, but that we submitted a $250,000 grant request to the Washington State Department of Commerce to fund a systems administrator and informatics specialists. We expect to hear back in the next several weeks about that funding opportunity. We would work with the IPRTF and JPOP sort of to design the work plan for these positions, but really it's sort of this back end and front end position that we've been talking about this whole time. The state funding would be great, but is not necessary for us to move forward. So we want to sort of wait on the outcome of that decision before we hire these staff members, but we plan to advertise in 2023. Early 22, sorry, 24. I'm getting my dates wrong. Q1. So that's exciting moving forward. And also one of the initial strategies we've committed to in the Justice Project Implementation Plan. Stephen.
Go ahead, Stephen.
Thanks, Kayla. It's pretty clear to me from my time on the task force and on the stakeholder advisory committee and the implementation plan that this is an excellent beginning and urgent need. But far from adequate for what our data system needs are. So I hope that's being factored in, and I'm wondering if you could say anything about how to build out further. It seems to me there ought to be links to data staff and all of the stakeholders along the continuum. It ought to be built into provider contracts, and we ought to have the capacity to crunch just a hell of a lot of data.
Yeah, I think Stephen, as our health department, is working on sort of visioning what the there's another justice project, you know, like coordination amongst providers and what that looks like. And so thinking about what software systems folks are using for medical records, for case management. I think that is also sort of a parallel conversation that the health department's going to be leading. And I think leaking it into this data project will be important, but absolutely hear you sort of on the scope and scale. And, you know, we're not going to solve all problems with 2 staff positions at the county. So I hear that, and it's good feedback.
I'll just follow up quickly if I may, Dan.
Yeah, go ahead.
I do think the provider part of this is an unaddressed aspect of it. So I'm glad to hear the way you're weaving that in. But the law enforcement and court systems are still siloed to a certain extent. It's certainly not in any form that could be transparent to the public as well in a dashboard form, or even in their own interagency communications. So the government side of it, which would not be, I think, managed by the health department.
Yeah, absolutely. And I think as this is one of those things, right? Like as you start unpeeling the onion, you're going to discover more layers and more problems. And so a part of what this staff is going to help us do is sort of bring visibility and awareness to that internally.
Stephen, are you good? You good?
I'm good, Dan. Thanks.
Okay. Heather Flaherty. Heather, you're muted.
Thank you. I'm sorry if you mentioned this and I missed it. If you do not get the commerce dollars, what is the plan? And are you able to use Prop 4 revenue to build out this data need? Even with or without the funding that comes?
Yeah. So I believe the systems administrator position has already been approved by the county council as a general fund funded position. I think the plan is sort of irrespective of whether we get this commerce funding to take the informatics specialist back to the county council for approval early in the new year. So we really see this grant as a way to offset general fund revenue. And certainly it would be an eligible expense under the Prop 4 revenue, but I anticipate and believe we've sort of indicated that we would recommend using general fund if we don't get the Commerce grant.
Okay. Heather, does that satisfy your question? Yep. Okay, great. All right, Kayla, you can just
Okay.
keep going.
Okay. Okay, housing also. Some exciting progress on the housing front. The county submitted a letter of interest to Disability Rights Washington True Blood Supportive Housing Solicitation. A big thank you to Maya for making the connection with Disability Rights Washington and making sure we fully understand the opportunity here. But if we were awarded funding, we could leverage that with county funding to create a significant funding pool to provide housing across the continuum of service for both True Blood class members, and then using local funds for other justice involved populations. And by sort of braiding the two fund sources together, we think we could provide more consumer choice and range of options for people based on what their needs are. We also see, depending on the size of funding available, that this could fund the housing component of some prosecutorial diversion programming and or housing for response division therapeutic court clients. So who happen to be True Blood class members. So we are also likely to hear about this opportunity relatively soon. And once we hear about that opportunity, we're going to move forward with releasing sort of a justice oriented small capital housing RFP. And that'll either be a RFP completely with local funding that sort of is a result of that commitment in the implementation plan, or it will be a much larger RFP where we're passing through this Disability Rights Washington funding to local housing providers. So super excited about that, and really sort of waiting on pins and needles to hear from Disability Rights Washington about what the next steps are. And then I also just want to mention, I don't want to get too far ahead of a partner agency, but we have been working really closely with Lake Whatcom Treatment Center on some of their inpatient as well as supportive and recovery housing expansion plans. And I would say we're talking with them from our office in the health department almost weekly, trying to sort of provide some sort of technical assistance and encouragement and connections and support as they build out their housing programs. So also just really excited about that additional capacity potentially coming online.
Any questions on the housing component? I'm not seeing any. I have questions. So my questions are, the county and the city also passed the 1590, the House Bill $1590. I think the county's portion of that was around 2 million. I might have that figure a little bit wrong. And I think the cities were around 3 million. And then we also, the city also has the Bellingham Home Fund as well. And that's oversubscribed at this point. But I'm curious as to the county's, or your perspective on the county's portion of the 1590, which is a sales tax that keeps kind of going up. And then I'd also like to hear from Brian Thane, who's on the call today, as it relates to any integration with the housing authority, and like, do these things intersect or do they not? And yeah, I just want to hear from both of you on that.
Thanks, Dan. Yeah, I anticipate as the county thinks about it, sort of justice-oriented housing RFP, that 1590 will certainly be a piece of that puzzle. We're also using it for some supportive services and to fund some of the larger tax credit projects that are more oriented towards family housing. But I see the local funding mix sort of likely being a blend of behavioral health sales tax, ARPA, and 1590, 1406.
Okay. Brian, you want to chime in?
Sure, Dan. Apparently, even with my camera off, you can see me writing a note to follow up with questions on this. I'm intrigued, but realistically, I need more information. So
okay.
I'll check in with you, Kayla.
That sounds great, Brian.
Thanks.
Hey, so just one point of fact here real quick. I'm trying to keep us moving here as best we can. I know we still got stuff to talk about, but one thing I want to make sure that we don't do is we don't tie whatever subsidy dollars to AMI or area median income, and that's probably not on the table, but we're seeing that with our low income seniors at some of our low income housing tax credit finance buildings and housing, and it's really causing a problem because the split between AMI and where their SSI and SSD dollars comes from, it just keeps the delta keeps growing. And so I just want to make sure that when we do this sustainably, especially for these vulnerable populations that are justice involved and adjudicated. Does that make sense,
Yep,
Kayla?
that all makes sense. And we would anticipate that in addition to sort of an income limit on who can be served, that there's a housing expense consideration. So folks who are living in sort of justice involved housing that's funded by the county have some sort of that we're not cost burdening them
Okay.
based on the model. So I hear the concern, I understand what you're saying, and I don't anticipate that we would have that same type of issue in these programs.
Okay, thanks, Kayla. I see Courtney's hand up. Go ahead, Courtney.
Just offering this again as another like FYI, since we're on the topic of housing. I want folks to also keep in mind that currently with, between Base Camp and Opportunity Council, there are no shelter options for individuals that are on the sex offender registry. And I want us to keep in mind that that population, the data shows, are the least likely to recidivate. But housing is very difficult, and many people on the registry they also have developmental disabilities. They also have co-occurring mental health and SUD. We want them to get care too. Many of the folks that we see downtown wandering around, nowhere to go, many of them are on the registry. They can't stay at Base Camp. Opportunity Council will not serve them. And there are 2 houses that I'm aware of in town that are willing to house folks on the registry. But it's like, I mean, you pretty much have to pay rent. It's a little bit cheaper than, average rent, but it's really not a great situation. And so I know we're already talking about so many things that our county needs. Yes, let's remember the children. Also remember that there are adults and juveniles that may be on that registry, that their housing options are severely limited by those restrictions.
Thanks, Courtney.
Thank you, Courtney. Kayla, you can keep going. I don't see any other questions or
Okay.
any hands raised.
Okay, just real quick on the legislative stuff, and we can certainly have more discussion here. The legislative priorities are never really quite final, right? Because things are always evolving as we approach session and are in session. So this is where we're at right now, but I don't want folks to feel like this is a closed book if people have feedback or have emerging issues that they see come up throughout session. So our priority issue areas, these are places where we anticipate signing in support of bills that are in line with the county's position. You'll see I've bolded everything that I thought this group would be most interested in, but we absolutely are going to support more funding for affordable housing, for homeless services, for basic needs for folks living on the street, improve state coordination, Medicaid reimbursement rates, and sort of legal pathways to provide behavioral health services, adequate funding for indigent defense, and making sure that we're taking care of public health and the social determinants of health, as well as some other issues here that are high priorities for executives to do in the county council. The budget asks are a lot of the things that this group has talked about. So making sure the state legislature is funding the Medicaid waiver for treatment and jail transition services. We're working with the legislature on an AOC on a 5th Superior Court judge for Whatcom County, which will be primarily focused on in the short term on adjudication, but a long-term resource for the community. Sustainable funding for LEAD programs statewide. We're working with the state. Perry's been doing a lot of this work on building Whatcom County out as a pilot site for a prosecutorial diversion program, which will come with operational funding. Filling the capital gap on the Crisis Relief Center. And then supporting partner requests and making connections for community partners with our state legislative delegation. So an example of this would be Lake Whatcom Treatment Center. And then we have some other projects sort of on the childcare side where we're trying to facilitate similar connections and express our support. On policy bills, they're pretty focused on land use and housing. I would say that the main thing that this group's gonna be interested in is the county council's passed a resolution encouraging the EDI board to consider making housing allocation recommendations from the county's economic development fund. There was a statutory fix a couple years ago that allowed, was supposed to allow counties to use that money for affordable housing. There was a mistake in the legislation. So we are working on leading an effort with Skagit County to make yet another technical fix to the bill to allow us to essentially invest economic development funds in nonprofit affordable housing development. So we're super excited, and Representative Rammel and Representative Lowe have been working with us closely on that. That's kind of the bulk of it, but happy to entertain feedback and answer questions.
Committee questions? Okay. I don't see any questions. I don't see any hands raised. I just want to.
Dan, this is Brian Estes.
Yeah, go ahead,
Sorry,
Brian.
I'm driving. I can't raise my hand.
That's okay. Go ahead. You're
I
fine.
Yeah, I hope the county would support. I don't know the member that introduced it last year, but a bill that provides psychologists with prescribing authority for mental health. And they would have to be a PhD psychologist and they have additional training. This is very much needed because there's simply such a dire shortage of providers that can be able in a timely manner to prescribe medication. So I hope, I would urge the county to support that bill.
That's interesting, Brian. Thanks. We'll take a look at that.
I see Peter Fraser's hand up.
Kayla, in your discussions with our legislators, what sort of heads up are they giving you on what the expectations are for this session? Anything you could report there from this list? And then also, obviously, workforce, behavioral health workforce is just critical to us. And what I see behavioral health with an exclamation mark after it. So that could include all sorts of things, but I'm just wondering.
Yeah, absolutely. Workforce efforts, right? Like
Yeah.
we're about to build out this crisis relief center. Everyone saw the article in that Cascadia. I'm sure we've got to make sure we have the workforce ready to staff these things. I think that behavioral health and housing are top priorities for the legislature, and we are likely to see some good moves this session, is my sense from just hearing legislators' interest and then talking with colleagues in Snohomish and King County. I think on the housing side, legislators are looking at a sort of progressive real estate excise tax to fund housing initiatives statewide. So that wouldn't be a local option tax, but something that would, allow or sort of shift the burden to some higher income brackets on real estate excise tax to generate some more revenue. On the behavioral health side, we're hearing about Medicaid reimbursement rates, workforce, and then there's a lot sort of happening around this diversion, true blood stuff. So I think we will probably see some more bills related to that and some stuff being reworked. On the budget, obviously it's a supplemental session, so we've got to manage expectations and we're asking for a lot. I think the key here is like these aren't all really sort of Whatcom County asks. I mean, the Medicaid waiver is a statewide ask. That's implementation of something they've already committed to. The Fifth Superior Court judge is coming from an AOC decision package. LEAD's coming from a statewide ask about LEAD programs generally. The prosecutorial diversion ask is part of a decision package through states. sort of behavioral health division, and we would just be, they're interested in expanding to other sites. So really the thing that we are asking for that is really coming directly from us is this gap funding on crisis relief centers. And, $2 million plus is a big ask after we've already gotten 9, but other counties are asking for these as costs are escalating on these facilities that the legislature has funded. So they're aware of the need there. Sorry, that was a mouthful, Peter.
Further questions for Kayla on legislative priorities? I don't see anybody. Thanks to you guys for being gracious. I'm doing this on my phone, so it's very, very challenging. It's on a selfie stick on my island in my kitchen. So anyway, okay, I guess a couple things. One is I want to make sure the committee knows that the county, the city, and the port share these legislative priorities, and we go over these as councils and I guess with the commission, with the port, to make sure that we're all on the same page. There's been some discussion about having a broadened tripartite ask when it comes to the state. So we have specific things within the city, like MOTCA dollars, which is the Model Toxic Control Act, funding for some cleanups that we have down along the bay that the county may or may not have. So I just want the committee to understand that there's a kind of a blend of a lot of voices on these issues. And as it relates, Kayla, to your remarks just now regarding the crisis stabilization or relief facility, I think that we can make a case for us being a pilot or a second pilot, I guess, in the state when it comes to this, in terms of that additional $2.5 million in funding. I think that we have proven ourselves with this task force, with this Law and Justice Committee, with the committees that you're speaking with today, it's very unlike most communities in Washington State. So let's make that case to get those additional funds. Okay, so I'll stop pontificating. David Freeman, Judge, go ahead.
Thank you. I did want to comment just on the fifth judge issue briefly. That's not directly related to this committee. However, it is critical, I would say, in the legislative package this year. Because of the water adjudication, we're looking at between 5,000 to 20,000 litigants coming in on that water adjudication. I think we have an average of somewhere in 7,000 to 8,000 filings a year in Whatcom County Superior Court. And we're talking about upwards of 20,000 litigants over a 10 to 20 year period. So while it's not directly related, it absolutely is related to the speed of and availability of judges and access to justice in our community. So it is a big one. So I did want to highlight that a little bit, although not directly related to the incarceration task force.
Thank you, Judge. Raylene Kane.
Thank you. I noticed, it was talked about yesterday at the full task force meeting with the need for public defense. But I just really want to emphasize on how strong the need is to get attorneys to represent the unrepresented right now. I am hitting the ground and I'm trying to find attorneys anywhere I can look. I'm going statewide. It seems like it's a nationwide shortage. And yesterday at the end, I heard somebody saying, well, what about the charges? And I'm looking at the charges for people that are unrepresented, and rape, controlled substance with 4 counts, possession of a stolen vehicle, domestic violence charges, criminal impersonation, more drug charges. And realistically, these are really serious charges that I am struggling trying to find counsel to be appointed to these cases. And so we really need to encourage attorneys to come this direction and try to help these people. Thanks.
Thank you, Raylene. I see Courtney's hand up.
Yeah, I just want to echo what Raylene just said and just really vouch for my attorneys. And I mean, I'm a non-lawyer, I'm a social worker, but I can't tell you how we mentioned earlier about the social service and mental health provider shortage. There's also a national public defender shortage, and public defenders are the social workers of the courtroom. We all rely on them without even knowing it. And without someone else on the other end of the aisle, you are up against the state on your own. And yeah, we've got to get more PDs in here. And thanks for Raylene for acknowledging that. I think in a lot of these community conversations, like Dan was saying earlier, there's other towns, cities, places doing these things. You know, there's a lot of talk about prosecution, but people forget about the PDs, and they're doing amazing work over here, but I'm obviously biased.
Thanks, Courtney. Yeah, you know, the conversation that we had yesterday at the full task force about the lack of public defenders was very eye-opening. People, it affects the defendants, it affects families, it affects everybody. So I don't know how we fix that. It's easy to point to a problem, it's harder to come up with a solution. So I don't know if that's part of the legislative ask, is like, you know, can we have more lawyers? Like that just is not going to be something that the ledge can magically snap their fingers and make happen. But I do want to acknowledge that we have that deficit, and it's really that discussion was very poignant yesterday. So I want to thank Maya Vanyo and others for bringing that forward. So any further discussion for the ledge priorities in the room here? I don't see any. Okay. Next item. Jill, can you bring us back to the?
So what do you need? The next item after legislative agenda is other business.
Okay. Is there any other business for the joint legal and justice systems and behavioral health committees? We will be meeting, so we're going to meet 4 times again next year. And I think that our committees can probably bring forward agenda items that we want to discuss, and then braid those together in our first meeting. And I don't remember when that is. I see Doug Chadwick's hand up.
Yeah, just real quick. This is my last behavioral health subcommittee meeting, as well as crisis stabilization. So in January, Steve Harris will be taking over my spot, and he'll be sitting on these committees. But I have I've been involved in a variety of, a lot of you are in a lot of different committees that I've sat on, and since about 2017, where really talking about the intersection between law enforcement and mental health, substance use disorders. So I've appreciated your perspectives, your comments, and it's going to take everybody in this community to make an impact. Again, we talk about the fentanyl epidemic. We talk about wanting to divert people, and I hear the frustrations from some of those in this room about law enforcement not diverting enough people. It's not for a lack of trying, but unfortunately, there's a lack of capacity. There's a lack of workforce, and we've talked about it multiple times to include what we're doing for youth in our community. Because again, before we know it, they're going to be adults, and you'll be dealing with them. So keep doing the good work that you're doing, and I look forward to seeing what you do. There's a lot of projects, but Whatcom County's done a lot of good things between you know, the LEAD program, the Crisis Stabilization Center, you know, the GRACE program. You've got a new jail that's going to be hopefully coming online with significant behavioral health services in it. And I think that's going to help. So thank you, and good luck. And I will be, I'll be watching, because this is my community, and I want it to be better.
Thank you so much, Doug. Really
Thank you, Doug.
miss you, and come by and speak up.
I want to take a moment here to acknowledge the undersheriff. Doug Chadwick has been a leader in our community and on this team for a long time. And having the perspective of law enforcement who's there every day, doing the work, grinding it out, has been an immeasurable part of this this committee. And I'd like to point out that the undersheriff also was a leader in trying to figure out how we do co-responder models. And we talked about this for a long time. And Doug was the person that brought forward the that behavioral health component in the co-responder program. And he was a leader and was ahead of us, ahead of the Bellingham Police Department. It's not a slam on BPD. It's an acknowledgement that we needed to have a leader to push this thing forward. And I want to thank you for your leadership. I want to acknowledge that you've done a lot, and I appreciate you very much. Thank you for your leadership.
Well, thank you for the kind words.
Okay. That was hard to get through. We appreciate you, Doug. Okay. Other business for the committees. Okay, seeing none, I will take this information back to the Behavioral Health Committee, and we're going to be talking about priorities for 2024. And we'll be meeting again sometime, I think, in the first quarter as a joint committees, and look forward to that. Jill, what's the next item here? I don't have the agenda in front of me here.
Sure. The last item is public comments.
Public comment. Jill, do you want to call on the attendees and see if there's anyone who wants to speak?
Yes, we do have a number of attendees. If you would like to speak to the committees, please virtually raise your hand by selecting the raise hand icon or by dialing *9 on your phone. We have one hand raised. Jason, go ahead and speak to the committees.
Hi, good afternoon, folks. Jason DeForest, local business owner. I'd like to point out a few things. Whoever keeps asking about the speedy cop drop-offs, please stop. Let's instead focus on safety, no matter how long it takes. The police departments have shown that their lack of patience leads to serious errors in policing. Really, what's important here is police accountability and healthcare worker accountability. We need to stop overcharging, stop entrapment, stop discrimination, stop prejudice. And on that thin blue line that separates people from charges, start building friendships and connections. Thank you.
Thank you, Jason. Any other hands raised?
If anyone else would like to speak, please virtually raise your hand now. And I don't see any of our remote attendees raising hands. Peter, do you have anyone with you in the conference room attending in person? Nope. Okay, that's everyone.
Okay. With that then, we all get 22 minutes of our life back. We were supposed to end at 1 o'clock. It's 12:38. Thank everyone for attending. Appreciate your work, your service to the community. And I'll go ahead with that. We'll be adjourned. Thank you.